It's Nurse Whit here. I want to talk to you guys tonight about what to do if your water breaks and a couple things to keep in mind. There's 4 things I want you guys to remember if your water breaks, and that's the time your water has broken, the color, if there's a color you notice to it, if there's any odor, and the amount. And I'm going to go over each of those things and why those things are so important. The big reason that they're important, the nurses and doctors are going to ask you when you get to the hospital about those things, like, oh, my water broke. Okay, what time? Okay, was there color? Was there any odor? And how much was there? So with the timing, once the water has broken, babies lost their protective barrier to the outside world, so to speak. So if you're full term, that kind of gives us a timeline as to when we need to get baby out. Like, okay, her water's been broken at this time. So some doctors will say at 24 hours, some will give up to 48 hours. Everybody's different. It depends how baby's doing. But once that bag of water has been broken for a while, mom is susceptible to infection and so is baby. Now, if your water breaks in your preterm, they can give you antibiotics because we may want to keep baby in there for a little bit longer, depending on how preterm you are when your water breaks. Every case, every mom and baby are different. So always go to your doctor if you think that your water has broken, because the timing is so important. The next thing is the color. If you ever notice a color to it, like a green, it could be lime green or dark green, that means the baby has pooped inside. And that's something that we want to know when you get to the hospital. It should always be like a clearish, maybe yellowish, but we need to know if the baby has pooped inside, because then we can have, most hospitals will have the NICU team available, and they'll want to suction the baby out as soon as baby's born so they don't swallow any of that. A lot of babies do poop on the inside. It can happen. So please let us know if you notice any color to it. Also, if you notice any odor, odor can be a sign of infection. So if when your water breaks, you notice something smells a little different, let us know too, so that we can kind of look into that a little bit when you get to the hospital. And then the last thing we want to know is the amount. And that's because sometimes it could be just a small little trickle, or it could be a big gush, like water dripping down your leg. So just let us know. Even if it's a small little trickle, do go to the hospital to be seen, because it could just be a tiny little leak, but that baby has still lost their protective barrier. So even a small little leak means your water has broken. And there's testing, AmniSure testing that we can do when you get to the hospital. So that is all I have to tell you guys for now about your water breaking. Let me know if you guys have any questions. If you're going to ask me if your water has broken, I'm going to tell you to go to the hospital. Go to your doctor, get checked out, or your nurse midwife. But thank you guys all so much. Make sure you check out my other videos, and please hit that follow button. I'll talk to you guys all soon. Bye-bye.